Hello and good morning to everyone, and welcome to day 2 of DigiFest 2020. I'm really pleased to have been asked to give today's welcome and understand that we have an audience around the world. And that reminds me of an event I was at in Berlin a number of years ago, where I gave a keynote presentation. And at the end of it, someone from Finland came up to me and said, "Are you really Scottish?" And I said, "Yes, I am." And he said, "Well, that's really strange because I could understand every single word you said. So I hope that our worldwide audience understand me and that my accent does not get in the way." So I'm Nigel Henderson and I'm Chief Executive of Penumbra. And Penumbra is a third sector organisation, a charity, a social care organisation, not-for-profit organisation. And we work exclusively in the field of mental health across Scotland. And each week we support about 1,800 people. And that can be anything from a few hours of support a week to 24/7 support. And we have a variety of different services helping people who experience mental ill health. But we're also here to promote good mental health and well-being and to provide early intervention and prevention services, as well as support for people who experience longer-term mental ill health issues. Today's theme is digital solutions for sustainable health, housing and care systems. Health, housing and care. 3 words you don't often see together, but I believe these are central to the well-being of people. And I want to explore a few things with you in the 15 or 20 minutes that I have before I hand over to the panel session. And I'd like to talk a little about Penumbra and some of the work we've done in the digital space. I'd like to maybe explore a bit about mental health and digital and mental well-being. And then the thorny question of data and data sharing, and perhaps touching on the issue of digital inclusion or exclusion. And then to say something about the wider third sector or social care third sector activities around digital as well. So just thinking about the theme of health, housing and care, that's very much the space that Penumbra works in, where we're at the interface of often health and housing, and we are there to provide care and support for people with mental ill health. So we have a range of services. When we started, we were very much in the forefront of the supported accommodation developments back in the 80s, when people were moving from long stay institutions into the community. And I guess we've moved on a lot since then, and we continue to work with a number of housing partners who provide the physical space, the buildings, the apartments for people. And we provide the support. And I think that's a much better way of doing things as we've moved forward, separating the housing from the care and support, but nonetheless working together to ensure that people's well-being is met. So when I look at Penumbra and our digital transformation, I was thinking back to the days when I first got a laptop in the early 90s, mid-90s, and twice a day, I used to get a whole batch of emails that would come in as the system cranked up to make a telephone contact with the server and to send me my emails. So it all feels a long time ago, and we've moved forward so quickly, but in relative terms, it's not really that long. In late 2018, Penumbra decided to go on a digital transformation journey. And we began to look at what we thought we might need. And we brought in some consultants to work with us to really scope out what it was that we wanted from a digital system. So we knew that we wanted something that would work for all our staff, and particularly our frontline staff who are out and about, visiting people in the community, visiting people in their own homes, supporting people to take part in community activities and so on. So we had to have something that was flexible, that was mobile, and ultimately something that was cloud-based. So we did that scoping work, and in April of 2019, we launched what we called internally Project Sky, where we were going to introduce a fully integrated system that would cover our HR, finance, payroll, fundraising, but more importantly, also our care and support planning and the work that we do with the people we support, and something that would allow the staff to access and see up-to-date real information about their rotas, their rostering, and so on. So we were given a proposed timeline of 1 year to implement this process. And I thought that was very ambitious. And I wondered, having heard from others who'd similarly gone through a digital transformation, that sometimes these timelines slip. However, I was absolutely delighted when in January this year, we went live with our system. And thank goodness we did, because come March, when lockdown came and we all started to move to working from home or elsewhere, we really needed that new system, because we wouldn't have been able to do it in the same way if we had still had our legacy systems. So that was timely. It was perhaps fortuitous, but nonetheless, we have had fantastic feedback from our staff about the fact that they now have smartphones or tablets or laptops, and that they can access all they need. So they have a genuinely sort of mobile office, if you like, in the way that they can connect with us. We've obviously, like everyone else, had to embrace this whole new world of video conferencing, video connections, video meetings. And that has, again, been something that staff have embraced and got used to very quickly. So I think what we have seen during COVID is that ability for rapid change and rapid adoption of new ways of working, which is fascinating, and really puts in place what can be done when there's a will, and when there's perhaps a pressing objective that needs to be met. And when we think of some of the stages we've gone through previously and how perhaps we haven't always been very good at implementing key policies, then I think there's a lot of learning to take from this current situation. So our next venture for Penumbra in terms of digital is to look at how we can move into our phase 2 of our digital transformation. And that's more about how do we utilize the full scope of Office 365? How do we make more use of the file sharing and things like that that we have? And we are also very keen to look at how we make some of our support plans and personal information about the people we support, how we make that available to them so that they can get that when they want it as well. And perhaps when to see if they want to share with any family or friends some of that support planning or the work that we're doing. In Penumbra, we focus very much on outcomes, personal outcomes for people. So yes, outputs are important, but equally important are the personal outcomes that people achieve. And a number of years ago, we set out to measure what we call recovery in mental health terms, or in fact, what we've ended up with is something that measures people's well-being. And we developed a tool called IROC. And IROC is now available as a digital system as well. And I'm delighted that we've actually been able to translate that into a number of languages, and that it's used by about 80 organizations around the world. And I'll just shamelessly plug IROC. You can find that in one of the booths in the expo area on this site. So please go and have a look and see what you think. So as I start to think about the wider field of mental health and mental well-being, and I guess in 2020, we've probably heard the phrase mental health or mental well-being far more often across the media than we have perhaps in the last 20 or 30 years. And so mental health and people's mental health and well-being has really come to the forefront. And I think what we see is that if you go online and look up mental health apps or mental well-being apps, there are thousands of them, if not hundreds of thousands of them. How do we know if any of them are any good? How do we know if they work for us? And so there's possibly a need for some sort of, I don't know, an aggregator or something that actually helps us to decide which are the useful ones and which are the less useful or indeed unhelpful or potentially dangerous ones as well. But I think the opportunity to use online and digital tools for people's mental health is absolutely the way forward. However, we mustn't lose sight of the fact that a lot of mental health work actually is really importantly done face-to-face. And what we're now seeing, and certainly within Penumbra, is that we're beginning to develop a blended approach to delivering some of our support. So that some of the support can be done online, some of it can be done via video conferencing, telephone calls, things like that. But equally, the face-to-face bit is still very important. And I guess we can probably all relate to that because we've probably all experienced that sense of slight isolation where, yes, you can see people on a screen, but it's still not the same as having that human contact and that human connection that I guess as social animals, we really crave. So I think we have to look then at blended approaches. There can't be one way and one size fits all. We really have to look at what best suits the individual. And when you look at some of the things that have been scaled up in the last year, or certainly since March, you know, we can look at some of the platforms that are out there, the services that are out there. So you look at things like the text services like Shout or Breathing Space, Samaritans, who also then offer the telephone support. And we've also seen in Scotland the development of the NHS 24 Mental Health Hub. And that's been really tremendous piece of work to scale that up and make it 7 days a week, 24/7 is fantastic. And then we've also seen, and the Scottish Recovery Network have just published a paper on their website about the use of peer connections. So people supporting one another online. And we've begun to see how groups that used to meet physically together have now moved onto an online space where they can offer peer support to one another. And again, you know, it's not exactly the same, but it certainly has worked and kept people connected and kept people together and given them an option to stay in touch whilst the pandemic continues. And then you have bigger platforms like Togetherall, where people again can get peer support, and that's a moderated platform and a very safe place where people can meet and share experiences, share ideas, get support, get some companionship. And in mental health and in recovery, we talk about recovery as being a sense of living a good life in spite sometimes of the signs and symptoms of mental ill health. And there's a phrase or an acronym called CHIME, which has been identified by researchers as the 5 key components of good recovery. And CHIME stands for connectedness, hope, identity, meaning, and empowerment. And I wondered if there was a way of thinking about that in a digital space, and so that sense of connectedness. So do you have a connection? Do you even have Wi-Fi? Do you have broadband? Hope. Hope, so that the connectedness helps you have hope for some of that connection that you will have with people and the ability to stay in touch and up to date. Identity. Am I safe online? Have I got a safe space here? How am I protected? How is my personal data protected? Meaning, can I find a meaningful way to use digital in the mental health space? And empowerment. Do people get to decide and make decisions about how they use that digital so that something is done with them, not done to them or for them? So I share that with you because, you know, I do think we have to think carefully about the digital space and how it is used for good. Because we have also seen, and certainly some of the work that I've been involved in around suicide prevention would suggest that sometimes the digital space can be a harmful place. And we need to do more to prevent the sort of online harm that can sometimes occur when people are not sharing such useful or helpful information. And at this point, you know, when I think about hope and that whole sense of purpose that people have, I want to throw in a quote. And one of my favorite quotes about hope is from Seamus Heaney, the Irish poet laureate, who said, "Hope is not optimism, which expects things to turn out well, but something rooted in the conviction that there is good worth working for." And I think when we look at mental health, mental well-being and the digital space, then undoubtedly there is good worth working for. And that takes me neatly on to that sense of data and data sharing and what we all do. So when we think about health, housing and care services, they probably all use different systems. Those systems probably don't talk to one another. We all keep our own sets of records about people. And often people talk about every time they have contact with services, they have to retell their story. And that gets very tiresome for people when they're telling their story to different agencies at different times. And sometimes the record that is there maybe reflects a slightly different story as well, from situation to situation. So how do we prevent people from having to tell their story countless times? So and I know there's work going on by MIDEX and others around that sense of creating citizen data stores, where people can keep their own personal data, where they can keep things like their support plans or the tools and tips and techniques that help them. And they can also look to share that data as they see fit with the agencies that they might be working with or being supported by. And I think we've got a lot more to do in that space to make that a reality, that people can have a safe online data store for their own data, and that we are able then to use that as a way of connecting people with the different systems so that we're not all asking them to retell their story countless times. And then I look at things like digital exclusion. And I think this is a real issue. At the start of the pandemic, we did a survey of the people we support. And as I say, it's about 1,800 people a week that we support. And we found that at least 10% of people did not have access to digital. So they either didn't have Wi-Fi at home, they didn't have broadband, or they didn't have a device in which they could access that. Some people had smartphones, but interestingly, they couldn't afford the data packages. So they often had the smartphone, but they only used it for telephone calls or texting. So we looked to see what we had, and we managed to hand out a few of some tablets that we had to some people. We were also able and very pleased to see the Connecting Scotland initiative, which has continued and is continuing to build to actually give people access to digital support and the kit to go with it. And we've been fortunate to receive some of that funding as well in some of our services. So I think that's really good. But I think we have to go further, and I think we have to think about digital inclusion as a human right. And I heard the Cabinet Secretary, I think, mentioned this yesterday. And I think these are great words, but how do we start to put that into action? What does that look like? Do we need a public broadband service? Do we need to have more public Wi-Fi? How do we actually make that safe? How do we make that a reality for people in our communities? And certainly for our workforce, we increasingly need people who come to us who feel competent with using digital tools and techniques as well. So, it's a challenge in terms of how we educate, how we support, and how we move forward. Because if we don't, we are simply adding further to the inequalities that some parts of our society experience. And if I look to the third sector experience, then we know that we've been very nimble. A lot of organizations have been really nimble. And I'm really looking forward to this next session where people will be talking about their the work that they've been doing. And that particularly, and I'll give a big mention to Blackwood, who've done a lot around smart homes and using sensors, using aids and adaptations that are digitally powered. And I think they've done a fantastic piece of work. And I would also give a quick name check to CCPS, the Coalition of Care and Support Providers, which we're part of. And they have their own digital project as well. And you can find that on ccpsdigital.org. But my time is now coming to an end, and I will start to wind up. And thank you for listening to me today. But before I go, I would just like to point you to the fact that we have the Expo site that you can go to on your screen. You will see it on the left-hand side of your screen. And in there, you'll be able to find the booths where we have some exhibitors, including IROC, he says, again. And also today is the first day of our poster session, and you will be able to find posters in there on the theme of health, housing and care. So I will shortly hand over to the panel, and to access that you need to go to the sessions tab and click into that. And in that you will find that we're having a panel discussion now about digital solutions for sustainable health, housing and care. And Peter McLeod, who's the Chief Executive of the Care Inspectorate, is going to be moderating that session. And he'll be joined by Angela Curry, who's the Operations Director at Blackwood, Moira McKenzie, who's the Director of Innovation and Deputy Chief Executive of Digital Health and Care Innovation Centre, and Rod Bond from Empower in Ireland. So I hope you enjoy that session, and thank you for being with me today. And I will now pass over to Peter.